Welcome to Mic'd and Medicated. We are so delighted because we have Dr. Caroline Messer with us
Dr.
today.
Caroline sounds really good. I should have gone an MD.
So, Dr. Caroline, I will let you introduce yourself, but suffice it to say, we have so much to talk about with you because you are a double board certified doctor in internal medicine, endocrinology, diabetes, and metabolism. So maybe you could just kind of share a little bit about yourself and how you came to be a doctor and
also what
do.
endocrinology is. Because we both have thyroid issues. You're my doctor. I think Dr. Caroline Messer is a freaking genius, best in the business. But can you kind of explain what endocrinology is or what your endocrine system is?
Okay. So I'll start with why did I become a doctor?
Yes.
Start there. So first of all, my whole family, everybody's a doctor.
Oh my God, you're so lucky.
3 out of my 4 grandparents were doctors, which is obviously really unusual.
Yes.
Because you had a grandma who was a doctor.
I had a grandmother who was a doctor. So in the 1930s, she got her MD in Germany. The story is, and it's actually a true story, she and my grandfather met on the bus, or actually, no, on the train on their way to medical school. And he fell madly in love with her. She was like the genius. He sort of was struggling to keep up with her. She was like number 1 in her med school class. They left in the 30s, just before the Holocaust, came to Brooklyn where they opened a practice. And it was on the first floor of their townhouse, and they practiced their whole lives there. They were like the community doctors. She eventually got a neurological condition, which kept her in a wheelchair, and she continued to practice. They were tremendous doctors. They loved it. 2 of their kids became doctors. So my dad is a gastroenterologist. Actually, funny enough, my father-in-law is a gastro. My dad trained him. So it's like the whole family, everybody.
Oh my God, how lucky are you?
Yeah.
I have 2 step sister-in-laws who are doctors, but they're like a derm and an OB. I really don't have someone on speed dial like that. That's an amazing situation you have.
And it was the only thing I ever wanted to do. I mean, I never wavered from age
That's
3
amazing.
onwards.
Wow.
I was going to be a doctor. I got to college. Like, that was it. I was pre-med. I went right through to med school. And
Did you deliberate on what kind of doctor you wanted to become?
Oh, yeah. So first I went to college to medical school to be an ophthalmologist.
Oh, wow. That's like a difference.
Because I know it's crazy because I was legally blind. I got LASIK eventually. And then I realized this is so embarrassing, but I get really nauseated from like blood in the eye.
Oh, so you could not do that as a job.
It's so funny because I'm the least squeamish person you will ever meet. Like, show me blood anywhere, like bleeding intestines. I'm like, oh, fun. But like, show me a bloody eye and I start getting like woozy.
That's so funny because I feel like it's the least gory thing.
I just can't handle it. I still can't to this day. It makes me feel a little dizzy. So I was like, okay, this is probably not my chosen profession. So then I thought pediatrics because I love children. And then my first rotation on pediatrics was oncology, which is cancer.
Oh God.
So I remember like being like curled up in a broom closet crying on that rotation. I was like, this is not for me either. I was like, I'll have a lot of kids, but I don't want to be surrounded by dying kids. It was too much for me. And then I hit upon endocrinology, which I feel like is the best field in the world. It's like Dr. House. It's like internal medicine, but on steroids, because we really, can do such a deep dive into all the ailments of the body.
I know. I feel like people don't understand that your thyroid gland is really a pilot that controls your hormones, how you feel, your mood, your metabolism. And I know firsthand, I had thyroid cancer when I was 22. And then I met you after Dr. Felix, who was a great doctor, but archaic, who passed away. And you changed my life because you don't just look at, do you need Synthroid or this? You go so deep into looking in the body, and you discovered I was celiac, which made sense for years of constipation and like eczema. But it took till I was, I think, 33 years old. So
yes, thank you, Daddy, for putting celiac into my brain all the time.
It's amazing. Good break, because your dad's a gastro. Yeah. Unbelievable.
But isn't that amazing? It really just takes that doctor who's super curious and looking at the whole body and how it works together.
Yeah. I think I still love what I'm doing, and I am very curious. And sometimes I even say, like, I'm doing this out of intellectual curiosity, when I'm drawing extra labs. But I don't like to stay pigeonholed within endocrinology. When I'm seeing a patient, I'm definitely thinking about all of my internal medicine background and how I can make the patient feel better.
But I think that's the mark of an excellent doctor, because isn't that the future? Like this idea of having holistic care. And like, if every doctor's seeing one part of you and nobody's looking at you as a whole person, you're not getting the best care.
Right. I mean, you're making such a good point. A lot of people say, why do you have to do 3 years of internal medicine before you do another 3 years of specialty training? The answer is so that you can provide someday holistic care. Now, unfortunately, within our system, when you have 10 minutes to see a patient, you don't really have time to really delve deeper, right? You have to just give the Synthroid, change the dose, and move on because you're so rushed, which is a whole other issue.
The wellness industry, which I was health coaching for a little bit, has sort of caused a little bit of friction with the medical world. I feel, when my old doctor, Dr. Felix, rest in peace, like I used to say to him, can gluten affect my thyroid? And he'd be like, oh, food doesn't affect anything. Like there's no food relationship. Of course, that was, 100% affecting my thyroid. But you have these wellness people who don't have any medical degree. They have no expertise. Like I remember the medical media, like he had the celery juice craze.
Yeah. I remember this.
And people were obsessed. And he actually said that like everybody got thyroid cancer from Epstein-Barr or something. Remember that? And my husband's like, this guy sounds bizarre. And he looks up the back of the book and he's, where he went to medical school? His spirit.
Wait, like his spirit?
His spirit. He's not a doctor. He gets his medical knowledge from his spirit. So I feel like people hear all that shit and then it almost makes them want to stay so Western and so focus on medical stuff that because it's so out of control. But I feel like you've managed to find this balance of you care about the body, but it's not bullshit.
I mean, to be fair, Dr. Felix's point, I think, was if you don't have celiac and you go gluten-free,
it doesn't matter.
It's not going to change your antibody levels. It's not going to change your thyroid levels. It's not going to change your absorption. But certainly there's a huge overlap between Hashimoto's and celiac. They just tend to, they run together.
Can I ask, because lactose intolerance is a real thing.
Oh, I thought you were fake allergic to dairy because it makes you fat.
Exactly. I'm actually lactose intolerant, but whenever I say I'm lactose intolerant, like I don't eat dairy, my kids are like, that's a fake allergy. That's not real. And Caroline just
we can test for this, right?
You could go to a doctor, Eva.
Well, no, I did.
There are these doctors, they're called gastroenterologists. And they test for lactose intolerance and they can tell you it's like binary. You have it or you don't.
Well, maybe I'm so old that they didn't test back then, or maybe I did have the test, but I went to a gastro and he told me cut out all dairy for a week and it changed my life. And he said, you don't eat dairy anymore.
I mean, you could just have Jew stomach.
Yeah, exactly.
Well, I was going to ask that too.
What is that? Is that because we're inbred or anxious?
We're inbred. Too many shtetls.
But how come we're so smart?
But we're more likely to have
survival of the fittest.
So that's because, you look at.
No, it's not just that all the non-intelligent ones were killed. It's that unlike other religions, you had to be literate in order to be a Jew, right? Because literacy was such an important part of Judaism. Not to make this about theology, but it selected out all the people who couldn't learn to read easily.
Okay, that's why we're all very smart, but inbred, but anxious. That's also survival of the fittest.
Yeah.
The ones who are like, Hitler's not so bad, they didn't survive.
So actually 2 points around that. One, not just lactose intolerance, but also all autoimmune diseases are more prevalent in Jews. Is that also inbreeding?
Yeah.
Okay. What's the difference between being lactose intolerant and allergic to dairy? And why do so many middle-aged women also have lactose intolerance?
I mean, lactose intolerance means you have a true lactase deficiency.
You don't have the enzyme.
That ends with ASE, right? Is an enzyme. Remember that from school?
I do.
Yeah. So if you actually are missing that enzyme, which we can test, then you have lactose intolerance.
I can't wait to come test it. And actually,
dairy allergy is like you go into anaphylactic shock.
Right. It's like a histamine response. It's different. I'm going to have you tested.
Thank you.
Yes,
thank you.
Okay. Do you want to say? Should we do more? Do you have any other issues?
Hormones.
Oh,
Before you guys ask me a question I can't answer.
Well, I actually just started hormone replacement therapy.
Oh.
Yeah. I don't know how well it's working, but I definitely was excited to do it because once again, it seems like there was so much misinformation out there. I was very afraid of it and I didn't want to increase my odds of any kind of cancer. And then I went to a doctor finally after many, many doctors who knew and looked at my whole body and my whole situation and kind of was like, you're crazy. That's a flawed research study that people are still peddling.
So she's talking about the Women's Health Initiative trial for everybody.
Right. Wasn't that in the early 2000s?
Yeah, it was. Do you mind if I summarize?
Please.
Okay. So here's the issue with the Women's Health Initiative trial. For anybody who's not familiar with it, took place in Boston. It was testing a lot of nurses and it was looking at all ages. So, starting with menopause in their 50s, going up to women, I think in their 80s. And they looked at them as a whole, whether they were taking estrogen and progesterone, just estrogen, whether they were young menopause or older menopause. And their conclusion was that there was an increased risk of breast cancer as well as cardiovascular events. that was very surprising, especially the cardiovascular events, because we know that taking estrogen lowers the bad cholesterol, which is the LDL. I call it the lousy DL. So everybody thought, of course, if you take estrogen and it lowers your cholesterol, you're going to have lower cardiovascular events. But that's not what they found in the trial. So there was a full stop. They probably published the trial a little bit too early. They didn't actually do what's called a subgroup analysis, which is looking at different groups and how they responded until years later. And then there wasn't a lot of press surrounding that. But I will tell you the results of the subgroup analysis. So first of all, some of the women didn't need to be on progesterone, right? Because they had had hysterectomies or something else where they didn't have a uterus. So for anybody who doesn't know, you don't have to take progesterone. It's kind of nice. It helps you fall asleep, but you don't have to take progesterone with estrogen if you don't have a uterus or if you have an IUD that contains progesterone. So there were a bunch of women who didn't have to take progesterone. And when they did a subgroup analysis, they saw that those women who were taking estrogen, whatever type of estrogen for years, actually didn't have an increased risk of breast cancer. And what they realized is the progesterone that we were using back then, which we don't use anymore, it's called MPA, medroxyprovera, increase the cancer risk. And we know that progesterone can potentially increase breast cancer risk. So that was one thing. The other thing was when we looked at cardiovascular events, surprise, when they divided it up old and young, we found that young, like our age, nice and young, there was no increased cardiovascular risk. And then over 65, there was. And then it also really matters whether you're taking your estrogen through the skin or whether you're taking it orally. So when you swallow estrogen, it goes through your circulation into your liver. And then when it passes through the liver, it creates all these clotting factors. When you take estrogen through your skin, and that can be either a patch or gel, none of that happens. It doesn't go through that circulation. We call it portal circulation. And
wait, so is that bad that I take birth control pill? Yes.
Because you're young.
30, I'm 38.
And you
Babies
probably
don't get blood clots. This is for old ladies.
I'm a
like
baby.
us. You're a baby.
So when do I have to stop taking that?
When you're like 50, 55, then you're
I've
no
got
longer a
time.
baby.
Oh, okay. I like
Yeah,
that. That's
you're fine.
and by then you may
So my
not
toddler-
need birth control.
I mean,
shut up, Eva.
So some caveats, because I don't want to make blanket statements. She's not a smoker, which makes it safe. She also doesn't have a family history. Like, I know
Yes.
all this of blood clots, and nor does she have any. She doesn't have anything that puts her at risk for blood clots. If she did, I wouldn't be okay with her taking oral estrogen. But yeah, estrogen through the skin doesn't create blood clots. And so if you put all that together in a young woman, it's really safe and in fact protective.
Eva
Against-
55 is young woman, right? Or 51?
Excuse
Sorry.
you.
I'm like, wait, what?
52. You're 52?
I'm 51, Caroline.
Oh, sorry, 51. I'm sorry. I think age is amazing.
It's so interesting to me. Do you think that study and the way it was done without subgroups and being cut short, like, do you think that's partly a function of the medical community getting smarter over time? Or do you think it's also that there weren't women back then?
I was
and
just
how
going to
much,
say.
how much does
Just gonna say
having
that.
women in the field affect the way these women's studies are done?
There were women in the field. I mean, this is a little bit like conspiracy theory. I think people really wanted the fame. Like there were
Really?
there were whistleblowers even at that time saying you can't publish this. It's not ready. It's a flawed study. But that's how you make your name.
That's kind of, it's not why you just do Hippocratic oath and all that stuff. Like you don't do that.
Yeah. Well, think of how many people are not following the Hippocratic oath.
Oh my God. That's another thing.
So that's probably our next topic.
I was going to say there are a lot of, so there's the wellness industry, which is all bullshit. Not all, it is not your wellness industry, but like the
Non-medical.
medical medium, which is not a doctor. But then there are the doctors who say they're functional, but they just want to sell you shit, sell you products. Like that's very upsetting to me because then you really get confused. You have to find that trusted source. Like, how do you know what's real and what's not? And also, I think with wellness, there's so much fear mongering, and like you are not that person. You're like, because like, what is the biggest killer? It's not tequila. It's what?
The biggest killer?
Yeah.
Probably heart disease.
No,
It
I mean
depends if
like
we're talking
stress, right?
Oh, or stress. Yes. Stress leading to heart disease. Yes.
Right. Like, so that's what's going to kill you. Not, but the wellness people make you so stressed because they're like, oh, if you use this product, it's going to disrupt your endocrine system.
Right.
Use this makeup product,
Right. You use this nail polish, this endocrine disruptor.
Right.
Right.
Like my mom's like, you can't use gel. It's going to ruin your thyroid. I go, my nails make me so happy. That's
You're
gonna,
like, and my thyroid's gone.
right. That's true. But like, even my husband was like, you can't let our daughter play with makeup. It has endocrine
Oh
disruptors.
no. Even your husband's buying into it.
I
That's
know.
Interesting.
Can you explain why we're so stupid?
Please set the record. Are we allowed to let our kids do nails and makeup?
Yes.
Yeah.
And even all the beauty creams?
Yes.
Amazing. I feel so good.
And we
Yeah.
can have tequila, just, not for the
Yes.
breakfast.
Let's have some now.
Yes.
Yes.
Because I love tequila. Like I could have it. I have one every night, 5 nights a
And
week.
we should not be so afraid of taking SSRIs if they're going to reduce our stress.
Right. So I'm definitely on the minority here. So let me take a step back. I feel like people come in all the time being like, check my hormones. It's my endocrine system. And I take everybody seriously. I do the whole workup for everyone. But at the end of the day, a lot of times, right, it's depression and it's anxiety, which should be treated like any other condition with no shame. The issue lies in patients feeling a stigma and not wanting to see a psychiatrist. And so then I'm left with a choice. I can either just let them go, say like, your thyroid's fine, your cortisol's fine, good luck, or I can play psychiatrist. And so I've chosen to do the latter. I've learned how to do, there's something called Genomind. Has anybody?
Yes, I did it. I loved it.
It's fabulous.
That's how I figured out the right SSRI.
Yeah. So basically,
Lori Pluchik, Dr. Pluchik.
Yes. So you send away, it's like this little saliva kit, and it looks at basically like enzymes that break down different SSRIs, which are the antidepressants, anti-anxiety meds, so that you know which one you over metabolize and which one you under metabolize. Because you could be taking a big dose of Lexapro, but getting none of it, or taking a tiny dose and getting 10 times the dose based on how you're metabolizing it. So I've just decided to become a fake psychiatrist. I try to send to psychiatry. I really do. It's not like I want to be a jack of all trades, but when people won't go, I'll do the Genomind and I'll get them on the right medications. And I feel so proud of, lives that I feel like, I don't know, saved, but I've certainly made their lives so much better, which I feel like then impacts their health, long term, because we know that chronic stress breaks down bones, hurts the heart, causes so many medical issues, increases autoimmune disease. And so I treat that like any other medical condition.
Well, what's interesting, I think, and obviously we don't have the stigma because we're called Mic'd and Medicated, but there is this, I love medication that's prescribed. But there is a stigma, like people be like, I'm on no medicine. I'm, 70 years old. First of all, my parents, like every meal, it's like they pull out 50,000 things that they're taking. So I don't come from that. I come from like, I come from like, you need it, you take it. But it is kind of upsetting that people really do judge. Like I am on ADD meds, I'm on SSRI, and I actually added a new thing to my cocktail, which I'm sharing, even though I think there was I had some shame about it, is the GLP-1. And I just started, I guess, microdosing, or you would say, because of you actually didn't suggest it to me. But as you're the kind of person where my whole history and my thyroid and everything. And I was just not feeling good. And I was doing all the right things, exercising and eating healthy. And I was not the size I used to be. But I also was just like, it was clutter in my brain. Like, did I exercise? Did I eat? Oh my God, I ate too much, or I did too much, or it was giving me anxiety. I was like snacking at night. And you were like, well, you could try this. You don't need to, but like you could. And it totally changed my life in the past few months. I'm happier. But I think I used to judge people who didn't need it for like to lose weight.
Yeah.
And like, I don't know, how do we fix that stigma? Cause like, I just feel like I got rid of 30 years of like body dysmorphia and like eating disorder behavior, not eating disordered, food noise.
Yeah. I'm more than happy to jump on my soapbox about this.
Let's hear it.
So the first thing I'll say is, yes, it's very real. This like exercise bulimia, constantly exercising. And I think by going on these medications, we are going to prevent a lot of orthopedic injuries. So
my wrist was starting to kill.
Right, exactly. So it would be one thing if these medications had real complications, right? Then I would say risk, benefit. But let's go through all the myths. Okay, number one, does it cause blindness? In very old people with eye disease, there's something called non-arteritic ischemic optic neuropathy, where you don't get enough blood to a nerve leading to your eye. That's for people who have underlying eye disease who are in their 80s. It does not cause blindness in a healthy young woman. I keep referring to you as young. You're welcome.
In a healthy,
child. So it does not cause blindness. The other situation where vision can change is if you have really uncontrolled diabetes and we correct it too quickly. The vast majority of people who are getting on these medications don't fall into either of those camps. We used to think that it could cause pancreatitis. So everyone knows what the pancreas is. It produces enzymes, helps break down food. So there are two enzymes, amylase and lipase. We now know that those are increased in almost everybody who get on these medications, but it's not a precursor to pancreatitis. It's a totally different mechanism of action that raises those enzymes. And it's not, Adele, it's not a harmful mechanism of action. And so I would just suggest that if you're on these medications, don't bother checking them, because it's just going to scare your very well-meaning internist who's going to be like, oh my God, you have to stop them. That is ridiculous. You do not have to stop them. It doesn't matter if they're 4 times normal. If you're not having pain, nausea, vomiting, pain radiating to your back, you don't have pancreatitis, and it's meaningless. When they first came out, we worried that they caused pancreatic cancer. Why was that? It was because all the people who were getting on it had diabetes and were obese, and those are risk factors for pancreatic cancer, right? Chronic inflammation, disease states. They've done the studies. There's no increased risk. In fact, there's a decreased risk of all types of cancer, all types of obesity-related cancer. So anything that's being fueled by inflammation, high estrogen state, everything that comes with being overweight decreases. So like decreased risk of breast cancer and colon cancer and all of that. The thyroid cancer myth, most ridiculous myth ever. This is why rodents, or rats specifically, are not a good animal model. So the hormone is obviously GLP-1, and it has to bind to a receptor. Rodents, or I should not say all rodents, rats have receptors on their thyroids. Humans do not. Mice do not. No other primates do. And so, and by the way, like rodents die from medullary thyroid cancer all the time. That's like how they meet their demise. We don't. And we have not seen any increase in medullary thyroid cancer, this very rare type of thyroid cancer that occurred with rats at dose and duration dependent increases. So the thyroid cancer story is done. And if you have any other type of thyroid cancer, like our friend here,
like me, Caroline, non-doctor Caroline,
then you're not at increased risk. Maybe even better, because you don't even have a thyroid at that point. But like everything's a myth. So we have to also define, I know I'm going on and on.
No, this is amazing.
Difference between direct and indirect effects. So
wait, she's I got to hear this.
I have so much to say.
I love this.
Okay, I'm going to list all the things that indirectly occur. When you lose weight, no matter what the modality, here are the things that can happen. You can get gallstones. It's caused by the weight loss. It's not caused by the medicine. You can have hair loss. It's called telogen effluvium. It's transient. We give you a hug and tell you it'll get better. That is not directly caused by the medication. It's caused by the rapidity of the weight loss. You can get, yes, loss of subcutaneous fat. It is not Ozempic face. It is weight loss face. You can get loss of muscle. It is not a direct effect of the GLP-1 on your muscle. It's the rapid weight loss. And so all of these things are getting such a bad rap. But like, if you're committed to weight loss, which, you know, fine if you're not, but if you are committed to weight loss, you are committed to these potential issues, and they can all be dealt with. They're all, you know, a side effect of the weight loss, not the medication.
It sounds like, though, that's rapid weight loss, which
so what about me?
occurs when you are going, you know, 20, 50, 100 pounds down. Correct. I guess what I'd love to hear from you now, because this is amazing and eye-opening, is what are all the benefits? Because we know the weight loss benefits.
Can you use me as a subject too?
Yes.
I probably lost
let's talk about
10
the
pounds
patient who needs to lose 5 pounds. So
5 pounds.
Yeah, you're always gorgeous. So
thank you.
Agreed.
Yeah. I'm in the minority amongst endocrinologists. I know this. Everyone's like, you're not a candidate. You only need to lose 5 pounds. So here's how I feel. And I recently decided, do you guys know anything about Mother Teresa? Like, everybody thinks she was like this incredible saint, but do you know what she really believed?
No.
She believed suffering was important.
What?
She did. Look it up. She believed that without suffering, you don't make it to heaven.
That's sick.
It is sick. I mean, she did many wonderful things, but she was not the saint that we think she is.
Oh, interesting.
I very much don't believe in suffering. And if
you have enough suffering every day.
We have enough suffering. The world is insane. If you're not living your best life because you have food noise, you have brain clutter, you're just, even if you don't have that, even if you're just sad you can't fit into your clothing, what do I care if you want to take this medication and you might feel a little bit nauseated when there are so many potential benefits and really no catastrophic side effects? So let's go through benefits.
Yeah.
The answer is, I don't know if there are any benefits when you're trying to lose 5 pounds other than you lose 5 pounds. That's because all of the studies are looking at high doses, and we have to give you micro doses, which is like less than the lowest FDA approved dose or the lowest dose. So does it act as an anti-inflammatory? I don't know. But it can only be good, right? So some of the benefits we know.
It makes me happy. Like, I mean, I think it's giving me dopamine. Yeah.
Right. So that's why this works versus other medications. So we had other medications in the past, Qsymia, you know all about, that decreased appetite, right? So phentermine, a stimulant, decreases appetite. Topamax decreases appetite. Metformin decreases appetite. And yet
and those are for, you were using those for obese patients.
Those for weight loss. But you see 5 pounds, 10 pounds, maybe 15, then you're like, hooray. You're not seeing this kind of weight loss. And that's because this is affecting also satiety, not just hunger. And that's the key, right? It works. There are two different nuclei in the hypothalamus. There's one that controls hunger. There's one that controls satiety. This is down-regulating hunger, but more importantly, up-regulating satiety.
You feel satisfied.
You feel satisfied. It has to do with dopamine. It's kind of complicated. I can show you guys the pathways later on if you're interested.
No, but that's also why it's being recommended, or maybe it's already being used for addiction.
Right. So I use this all the time for my patients with alcohol abuse disorder, other addictions, every addiction.
I think it's also, I have ADD and I think it's related also. Yeah. I mean, I do, and I did the Genome, and it proves that test we were just referring to, that I have low dopamine receptors, low serotonin. Thank you, mom and dad, for passing me that. So I need to get, and I'm not someone jumping off bridges to get the high. I probably say inappropriate things. That's my high, but
how does
the GLP-1 has changed my life?
What's the difference between what you get from an SSRI and what you get from GLP-1? Is it the same?
No, it's different because I need both.
The serotonin that's in the synapses between one nerve and the next, versus this raises dopamine. But, some of the medications also raise dopamine a little bit.
But what is the difference? That is a good question, actually, because dopamine is sort of,
it's like the reward.
The reward,
transmitter, right? So you're having a bad day or you're having trouble paying attention. So you eat and then your dopamine goes up a little bit and you feel better. You've just rewarded yourself.
Right.
Yes.
That's the difference because I felt like when I went on SSRI, the health, anxiety, I would spiral, or just in general. And that didn't change the way I would. I guess you're right. It's needing the dopamine hit from Tracy Anderson.
Yes.
Right. I needed that.
Yes.
It was not even.
Do you think they're going to study it on impulsivity?
They already are.
Oh, okay.
Yeah.
Yeah. Because it makes so much sense in terms of why do people do these crazy things that either put themselves or others in harm?
Yeah.
Can I ask you another question just about Eva? Eva, do you mind if I use you as
sure.
the rat here, the subject? So Eva is natural. She's skinny. She's thin. She eats a lot, high quantity, low calorie food, but thinks about it a lot.
I think it's a control issue for me.
Right.
And I think it's probably not a control issue I need anymore, but it was developed as a coping mechanism. And now I think it's just habitual. Maybe it is still control. I don't know.
Would something like a small GLP-1 help that part of her brain?
I don't know. Let's try it.
You want to try it?
I can't wait till my appointment with you.
Right.
We'll try a tiny dose and see if you just let go a little bit.
Well, the other crazy.
That's what it feels like. It feels like I let go
in your brain.
But the other crazy thing is, who's the guy who wants to live forever? I'm curious about the longevity benefits too. There's somebody who wants to live forever. He's been microdosing it for a while.
He drinks his son's sperm.
Johnson, maybe.
Yeah, that's his name.
It's weird as hell, man.
It's so weird.
So, do you believe it also has longevity benefits?
I mean, insofar as it decreases risk of stroke, heart attack, death, sleep apnea, cancer. But
but that's only for people who lose weight and no longer have the weight risk factors.
I don't think that's actually the weight loss, because we see people with comparable amount of weight loss from sleeve gastrectomies, like bariatric surgeries, who aren't having those benefits. It's the anti-inflammatory effect.
So if I have inflammatory from stress my whole life, would it help that?
Yeah.
I mean, it helps inflammation. So this is not woo-woo medicine. We have
no,
these
I'm
markers.
over woo-woos. Okay.
No, this is I'm very evidence-based. Except microdosing. There's ESR and there's CRP. Those are inflammatory markers. When they're high, we can give these medications. We can see they go down. So they clearly decrease inflammation. That is why there's a decreased risk of heart disease. To be very clear, it's not the weight loss. So it decreases the work of the muscles in the heart, like the cardiac myocytes, which are the muscle cells. They have receptors for these hormones. So it's going to the heart. It's decreasing the work. It is making us live longer because we are actually healthier.
Do you think eventually this will be something that everyone takes?
There's a reason for everyone to take it. It's like, who doesn't have arthritis at a certain age? It decreases both osteo and rheumatoid arthritis. Half the country has sleep apnea, which is causing them to get AFib. If you don't have that, maybe you just have ruminating thoughts. Maybe you have body dysmorphia. Maybe you have a history of disordered eating and it sort of is always lingering in the back of your head. Maybe you just have a family history of Alzheimer's and you want to potentially decrease that risk, even though there was a recent trial called Evoke, which completely failed, like fell flat on its face. But to be fair, that trial was looking at patients who already had Alzheimer's to see if you could reverse all the plaques, et cetera.
That's just diabetes of the mind, isn't it?
Yeah, but it didn't. But the question is, could it still prevent it? And all of the earlier trials show that it slows, like it helps prevent Alzheimer's.
Also, like, okay, you know, I'm going to that Legally Blonde part of the movie. You remember when they were accusing Elle Woods' trainer of killing her husband? Remember? And she's like, no, my trainer works out all the time. And like, she gets endorphins, and endorphins make you happy. Happy people don't kill their husbands.
Yes.
Like, you know, the GLP-1, like it was the addition to my cocktail to make me really happy. I'm still angry, still mean sometimes, still a bitch. But in my head, I don't have that. Oh my God, am I that 12-year-old chubby girl again? Do I feel this? Like, it's gone. It's like I left that girl behind.
I love
like, can
that.
I be on it forever?
We have 20 years of data. You know, these medications have been out since 2006.
But now why would you have to go off of it to take like a colonoscopy and stuff?
Only because of the risk of what do we call aspirating gastric contents. So aspirating, you know, if the contents are sitting there because you cause too much gastroparesis, meaning the slowing down of the gut, they can come up and they can go into your lungs, which is called aspiration. They can give you a pneumonia, but no other reason.
But that's the only thing.
Yeah, that's legitimate. You do have to stop it to decrease that risk, although there are no actual guidelines on that.
So what is your forecast on accessibility and costs? Like, given right now, it seems, if the stats are still correct, that the highest number of GLP-1 users is the Upper East Side. Yeah. And I don't think that correlates with the highest number of obese people. So
I would say no.
But it was fair.
I'm like, everybody's
obese
tiny.
Is different here. Okay. I was obese 5 pounds ago.
So, you know, the oral version of Wegovy is now $149 a month. I know that's still a stretch for a lot of people, but prices are really dropping as the orals
Think about how much
out.
you'll save on food.
Do the orals work as well?
Hypothetically, I will say, I mean, it's only been out for 3 weeks and now 2 days, right? So I don't have that much experience with it. I have a lot of patients calling me, telling me it's not working as well. That's anecdotal. That's not what I'm supposed to be using as evidence. They certainly don't work. So we only have oral Wegovy. We don't have oral Zepbound, which is the
one I'm taking,
the better medication. I think the real game changer would be when that comes out, but that's not even being tested.
But can't you do, and I decided, sorry, Jeremy, to do the one that is not covered by insurance because it's easier. It's more of like an EpiPen situation.
How many of your medications are covered by insurance?
I'm going to plead the fifth on this one, but not a lot. Sorry about that. I like brand. Brand is always better. Anyway, for the Zepbound, you told me that if I wanted to,
what did you call it?
What is it called? Zepbound?
Zepbound.
Oh, I called it Zepbound.
Zepbound. Let's call it Zepbound for the rest of this.
Zepbound. Zepbound. Wait, question though. You did tell me that if I wanted to pay a lot less, again, sorry, Jeremy, I didn't do this. I could do the one that you have to like fill up the vial yourself.
Right. So Eli Lilly, the company that makes this, is now offering a cash price to patients.
Eva, you could try that one.
For the lowest dose, they're charging $350
It's the Marriott reward.
I'm not even going to throw you under the bus and tell
don't tell anybody
how much the real one costs. But right, so it's getting more affordable.
Looks so good, Jeremy.
It's getting more affordable. We're just getting started. There's so many new ones coming out. There's so much competition. Thank God we live in a capitalist country, and the prices will come down.
It's still not just like an easy ticket. I think that's what people think. Like, I'm still working out differently because I don't need as much cardio because I'm not trying to burn off what I ate in a crazy way. I mean, you still need heart health, but you still can't. You're still making good choices.
I hope so.
Right.
Because otherwise my business is going out of business. So my practice is all about, I'll give you these medications, but you'll also meet with our psychologist to work out your binge eating.
Right.
You'll also see our dietitian. You'll also work out with our trainer. You'll do everything necessary
it's not a
develop healthy choices.
Exactly.
Yes.
It's not I think that's where people can let go of the shame. That's where I'm letting go of the shame. It's not a Band-Aid. It doesn't just be like, here, you take this now, your life's on autopilot. You still have to be conscious. Yes.
Even if you did none of that, I didn't think you should feel shame.
You're right.
Exactly.
Even if you did none of it, it's still making you healthier. It's great to do that stuff. It's even better for your health. But let's just let go of this idea of shame.
Okay. Thank you. I appreciate that.
Yeah.
I feel like you're the Oprah of endocrinology.
Thank you.
Well,
I love
actually,
Oprah.
No, but I needed that. Thank you.
I was going to say is, well, first my question, which is sugar, because a lot of what you're talking about in my head, I was thinking those are all things that are reasons why I try to limit my sugar intake. So what's your point of view on sugar? Because you've been very, I think, relaxed and moderate about a lot of the other vices that we talk about.
I sort of take the opinion that we should have everything in moderation other than arsenic. Like, we can have some alcohol, we can have some sugar. If you're starting to binge eat on sugar and it's become an addiction, then I have to address that. And there's so many ways for us to address it, but it's an addiction like anything else.
Well, it's dopamine hit.
It's a dopamine hit.
Exactly.
But if you're having dessert a few times a week, I think that's great. So I don't think it should be something that we have to avoid. I think it's a wonderful part of life. Just like screens can be wonderful and alcohol can be wonderful and sex can be wonderful. You just don't want to be addicted.
Right.
Okay.
Or as Rachel Goldman said, you just don't want it to be your only tool in your toolbox. You know, I like that, right? Like you want to be able
so I think what you're saying is you don't want only one vice. You want multiple vices in your toolbox.
Little sugar, little tequila, little sex.
What I was going to say, which I think is maybe a nice way to end, is this whole time we've been talking, I've been thinking you are your grandmother. You are the community doctor.
That's the sweetest thing I've ever heard. I worshipped her.
Caroline raves about you, but I've had so many women say that they just adore you and that you have really been, phenomenal in treating them. And I think about your grandma, the community doctor in Brooklyn. And even though you are, endocrinology and internal medicine, from our conversation, it seems like you really do think about it as a community job.
I do. My first job was up in Westchester, actually, where you're from like Mount Kisco area.
Oh, I know. Well,
Mount Kisco Medical Group. I forgot what it's called now, Optum. And I did love my patients there, but I always had this sense that I wasn't treating my community. Like I wanted everybody to, I wanted the people I was treating to be the people I bumped into when I walked into the school.
You wanted the crazy New York City.
I wanted to treat my people. And now I am. And I love it. And I really don't mind when I see my patients all over the street. I love it. Like they tell me how they're doing. I see them in the park. I see them at synagogue. I see them everywhere.
I really love that. And just so you know, Dr. Messer has wellness centers where you have the Greenwich.
It's called Well by Messer, but it's like true wellness. Like it's not
woo woo.
I'm not peddling any supplement. Well, we do have supplements, but I don't sell them because I don't believe doctors should sell anything.
You'll send an Amazon.
They're free.
Right.
They're free for you. They're free for everybody. I don't sell a thing. So I have offices in Greenwich, Connecticut.
You sell happiness.
I sell happiness.
That was corny.
I sell love. No, I really do. I realize there's so many patients who blow a kiss when they say goodbye, and I'm like, this is really nice.
Oh.
It really feels good. Greenwich. I'm opening up in Great Neck in 3 weeks. I have 3 in Manhattan, and then opening up in Coral Gables this summer, and just starting to work on West Palm Beach.
Amazing.
Dr. Caroline Messer, this has been a pleasure. Thank you.
Thank you so much for having me.
Thank you so much.
Thank you for listening.